Hello, everybody. I'm Christian Coachman, and we are back with Coffee Break with Coachman, our interview show where I try to bring some of the most brilliant minds in our industry from the clinical perspective, from the technical perspective, from the management perspective, from the digital perspective, trying to bring from the corporate perspective, trying to bring all the angles of dentistry by allowing me to chat with these super cool people that are really making a difference and bringing the cutting edge technology, understanding the new trends, and are always so nice to share their know-how with us over here. So today I actually have a guest that is coming back for the second time, Dr. Dominik Nischwitz from Germany, that is a friend that I was able to connect through a common friend that we have, Dr. Miguel Stanley, that is totally also into this topic. And one day maybe we're going to talk, the three of us, about this topic. But Miguel Stanley started to learn a lot about biological dentistry from Dominik, and this is exactly the topic: biological dentistry. What does that mean? And how can biological dentistry add value to you as a clinician, and mainly add value to your patient? So the topic here today is, how can you transform the way you screen your patient, the way you read your patient, the way you provide solutions that go beyond just a nice smile and beyond even a healthy mouth, really empowering dentistry, making dentistry play a much more important role in well-being in general through these new principles of holistic care, comprehensive diagnosis, and biological dentistry. So I asked Dominik to join us here today to talk about these trends. And of course, we're going to discuss conceptually what things mean in this environment, but I want to bring to you some very pragmatic, realistic suggestions, tips, things that can help you give your first few steps towards taking better care of your patients. Okay, so first of all, Dominik, thank you so much for participating once again. I want you to give a hello to the DSD community and give a quick introduction about who is Dominik and what is biological dentistry. Thanks again, my friend.
Chris, thanks, my friend, for having me. And hi, DSD community. I'm happy to, show you my way of thinking. And I'm a specialist in biological dentistry and ceramic implants. I'm also a naturopathic and functional medicine doctor from Germany. And biological dentistry, what we're talking about in the definition, in my opinion, is it's the overlap of the high-tech dentistry you guys are doing with functional medicine and health optimization / biohacking, which enables us to treat our patients for one common goal, I reckon, which is optimal health. Current medical approach for, let's say, health is more like health is defined as absence of disease. And we're taking it a step further into optimal health. And in my opinion, I believe this starts in your mouth, and because it's the entrance to the overall system. And this is where we're going to have a look in today.
Optimal health starts with your mouth. I like that slogan.
100.
Optimal health starts with your mouth. Can you repeat again, Dom, the three concepts that are overlapping here? You said high technology.
I would say high-tech dentistry, which includes, of course, metal-free and high-tech dentistry, like all the things you do, digital plannings, cone beams, the stuff you already know. This is one part, high-tech dentistry. Top notch. Then combine this with functional medicine.
Functional medicine
this is a medical field that deals with the overall patient. We do more comprehensive blood works there. We focus on nutrition, macronutrients, micronutrients, intravenous therapies of vitamins and other things in terms of preparing. And we're taking way more. So the history of the patient and his, let's say, genetics and the epigenetics play a big role in how to find out why these people get unhealthy in the first place because we're living in an epidemic of chronic disease, and it's not that we're really healthy overall, which you can see at the common, like the overall picture is that we're like not as healthy. So functional medicine is one big part, blood work. And the third one is a field called health optimization, which in itself is, in my opinion, the perfect description of what we do. We optimize health. So current medical, let's say, dogma is health is defined as absence of disease, but this is not what I'm after. I'm after like top-notch performance. I want to sleep perfect. I want to be healthy and don't, if possible, not age too fast, but the opposite, like get as old as young as possible, maybe. It's also commonly referred to as biohacking. Biohacking is a little bit more of the thing that cool kids do. So biohacking is sometimes referred to as like high technologies in this field, like tracking your sleep data with the stuff I have on my finger too. It's an Aura ring or other measurables. So basically,
tracking yourself, understanding yourself better.
Yes, tracking things to get better results. Like Peter Drucker said, for management, what gets measured gets managed. The same is true today with health and optimization. So I have a blood glucose monitor on my arm. I track my sleep. I basically track everything for the last years as much as possible. And for 20 years, I'm doing all these things, fine-tuning my body and, of course, the patients.
So by tracking, you can fine-tune the strategy. You can improve the strategy. You can customize the strategy.
Exactly. Basically, blood work is kind of like a tracking too, but blood work is very, like, let's say it's one single page and in seconds it changes. But imagine you could see your blood sugar levels throughout the day just by what you eat. How is your body reacting to various sorts of carbohydrates? Is it really tolerable, or is it like are you insulin resistant? This is something that helps us with overall chronic inflammation. Or what about tracking your sleep? We are all in the field of, I'm a surgeon, so I want to have my patients recover the best way possible. So of course I want to optimize their sleep, because when you sleep, you get into parasympathetic nervous system, you get recover, you regenerate, you detox. But you cannot imagine most patients are not able to do so because they're in a chronic state of sympathetic nervous system. But what if we can all measure this now with HRV, heart rate variability, heart rate? You just have to know like these single dots and then connect them, and you can do stuff on yourself.
So a doctor like you needs to really, first of all, help your patients to track themselves a little bit better, add some tools there to give some extra information beyond the normal. And then you specialize, of course, on reading these numbers, reading these information to create a strategy and provide the strategy to the patient, correct?
Yes, in my opinion, it has to start with the practitioner themselves. You have to know what you're doing and practice what you preach. So it's really a change in your mindset. You're becoming the high-tech dentist anyways, but you also can help patients and yourself get to next level of health and performance. So you will learn it on you, and then it's super easy and effective to track them and help them track, makes them accountable. So they cannot say, oh, the doctor ruined it. They have to take responsibility, and you can track it. So they are more like.
And I love when you say, it's not about only not getting sick, but is improving your performance. We have so many solutions now that we can go beyond just not getting sick. We can really have a better life by improving performance. And here, when people say performance, maybe some people say, oh, they're talking about how to support athletes and professional athletes. It's for an everyday person. It's for a normal person, right? You can have a better life by improving your performance on all these basic things by going to a doctor that understands health optimization, functional medicine, and how to use technology to track your numbers. So you said in business, whatever you can track, you can act on. If you have metrics, you can manage the issues, right? So this is what you do with biological dentistry as well. So I'm going to ask you something very, very simple to start here. I can already imagine that if I go to a very good dentist, but that doesn't have this vision, that only take care of conventional dentistry. You know, I go to this dentist on the first appointment for the first time, and they do a very good first appointment, following all the basic rules of classical good dentistry. You know, the pictures, the x-rays, the clinical exam, maybe a CBCT, you know, the questionnaire, the conventional questionnaire. So my question is, if I, instead of going to a conventional good dentist, if I go to a good dentist that is also a biological dentist that works with these things that we are talking, what are the main differences of this first appointment? What do you add to your first appointment when you see a patient for the first time to give you ammunition to provide them this extra care?
Very good question. Exactly. It is just the next level and just an upgrade. So what we give our patients, so probably the medical questionnaire already is a little bit more extensive up front. So we will, of course, ask for all these optimization questions, like how is your sleep? And what about some gut issues? So we will ask overall minor things that don't qualify as a, let's say, as a sickness or something, but more like a few symptoms. I can't sleep well. I can't sleep through the night. I wake up multiple times. So sleep is very important. We will also ask, how is your energy level throughout the day? Can you wake up without the alarm? Do you have like multiple times when you like crash throughout the day? Like performance asking questions. We also ask about nutrition. What does their lifestyle look like? Their nutrition, their lifestyle design. What are the foods they're eating? And how much do they use the Wi-Fi? How close are they to a, let's say, like cell phone towers? So we take a lot of care about EMFs. And because we want to know how their genetics act in this world, which is it's a field of, it's called epigenetics. So genetics is only this big. It's kind of like talent. If you have talent, but you don't train, let's say you would be a perfect sprinter, but you never train, you won't become one. So the same is true for genetics. If you have, let's say you can't detox very well because you have this genetic SNP. But if you have your lifestyle like as natural as possible, the genetic SNP doesn't care because your epigenetic is more natural. Yeah. And this is what we're all about. Basically, we are asking how unnatural is my patient living right now? How optimized is this already? Because 9 out of 10 points actually for everything we are going to do, and you know the goal is optimal health, is your daily lifestyle. What you put into your mouth in terms of food, what you have in there in terms of like restorations that might disrupt you or interfere with your epigenetically. So we ask, of course, all these questions and to get an overall picture. We also will do a little, very fast finger prick vitamin D3 level test just to see if you're in, I call it hibernation mode. If your body's like in hibernation, means you cannot regenerate because your vitamin D3 is too low. It sank through, let's say, wintertime. I'm in Germany, so 6 months of the year there's no sun. If you're in Brazil, you're a bit more lucky. And Madrid, so it's the same. So we check the vitamin D3. Also, all my patients will send in blood work before because there is no initial appointment like this. But if you would start it, we would also probably, if they come in, of course, for dentistry, we will check different metals. And if there's allergies, there are a few, we call that environmental dentistry. It's a part of biological dentistry. You have a few blood works. Of course, you have to take a little bit of blood and then check, is this patient maybe allergic to titanium? There's something called the titanium stimulation test, which you can do in a lab in Berlin, which will really show you, oh, this guy is already, this immune system is already attacking the titanium particles on a daily basis. Titanium stimulation test. We can also do a LTT, lymphocyte transformation test. It's also a blood test for any material in your mouth, starting from gold, like, you know, all you dentist guys out there, you know, it's like different alloys, and basically you can become allergic to everything. So this is something we will check before because we're always dealing with the immune system, the autonomic nervous system, and various other things in the body. Yeah, it's like a whole picture. It's not just the mouth. The mouth is the entrance to your whole body and not outside body. So we track all these measurements. And of course, like you said before, of course, we also do all the conventional dentistry.
Conventional, yeah. So
CT for sure.
So if I'm going to you and I'm going just because I want to have a checkup and a hygiene session, or if I'm going because I want 10 veneers, or if I'm going because I need a full mouth rehabilitation or I need implants. It doesn't matter the situation. Once I go to you for the first time, you're going to always go beyond and kind of cover all these things that you just said. You're going to incorporate this into my first appointment. Is that correct?
Exactly. It starts even before, but yes. Why? Because it's kind of like a challenge. We want to have an impact on the overall health of the patient. This is a mindset switch. So of course we do the perfect aesthetics and smile design and everything, but at the end, the patient comes in for various reasons. And you will always get testimonials like, oh, my chronic back pain is gone. I can smell again. I can sleep better. My depression is gone. My belly is better. And also, of course, I got some nice teeth. It's not like, oh, wow, it's only the focus on these tiny things. It's included in the whole picture because we are doctors to do everything. And of course,
I love that. I love that approach because, you know, as I mentioned before, we always say, you know, aesthetics should never be the priority, should be always the consequence, you know. And that's because usually if you're very healthy, you're functioning well, systemically, you're doing well, and you're happy, you know. It's well-being and happiness. You usually naturally look better anyway, right? So I love the fact that, you know, since aesthetics is such a drive for people, and more, even in Germany, people, I want a perfect smile. I want the ideal smile. I want a better smile, because the media is really show you need to look good. You need to look good. You need a better smile. And once you end up on a biological dentist, you get all these extra benefit actually that becomes the main thing. And it's like re-educating the patient, right? You need to re-educate the patient. Otherwise they will take it for granted, or they're not going to value, or they're not going to understand. So you probably have like a session where you explain, almost like saying, you don't know how lucky you are, but by the way, we're going to go way beyond what you were expecting. Is it something like that?
100%, yes. And this changes totally. So I did a little bit of research lately because I'm so focused on my things. So I had to interview a few conventional dentists. And so the normal patient actually doesn't like to go to see a dentist. It's more like, oh no, I have to go to see a dentist and he will drill a hole, or maybe I'm lucky and I don't have cavities and whatever. And some people, of course, go to a specialist for just veneers. They're very happy to have a new face and like a new smile. But most dentists actually are dealing with patients that don't like them, and they have to discuss money all the time, and if there's a cheaper solution, and is insurance covering this. So it's really negative and doesn't make any fun. Imagine patients coming in for a total new perspective. You can do your work, your tiny craftsman stuff anyways, but you're also able to get fans that you're helping with their overall systemic health. And I'm totally agreeing with Chris here. A healthy body is always aesthetic, and also a healthy body is immune against cavity and against all these problems. So when you train them with a new mindset that they really take care about themselves afterwards and take responsibility for their lives by changing their lifestyle, you will have a way bigger impact on top of the nice work. So they will appreciate it way more and don't come back and will find any fault on your veneer or something, because they then come with the tiny mirror and tell you, oh, this edges might be a little bit too crooked. This is not the focus anymore. They're focusing on improvement. And of course, they get nice teeth. And the nice part about aesthetic dentistry, this is how I started after university with surgery and aesthetic dentistry. This is also when we met, Chris, in Germany with Andreas back then, Anaxtend. It's like 12 years ago. So I was graduating. It's really a long time ago. And yeah, I started with aesthetic dentistry because this is the highest techniques. And the good thing is actually everything a cosmetic dentist does is as biocompatible or as biological anyways, because we're not using metals. We'll do a ceramic implant. Of course, you will do the perfect veneers, because nature is not metals. Nature is metal free. It's like sand or ceramics or whatever. So you can, it's just the next level. You have to have a few knowledge gaps, let's say, fixed in terms of how the overall body works. But this is just
so from the patient perspective, let me ask you that. You know, if let's say I'm a patient again, and we meet and we are chatting, and you're explaining to me what you do and why you are different than a conventional dentist, and of course, why you believe that this is the best way, the right way to go. And I'm thinking that what you're saying is interesting, and I ask you, so what is exactly the benefit for me? You know, if I'm a patient, you know, if you could summarize the benefits for me of going to a dentist that is seeing beyond compared to a dentist that is doing the conventional. If both dentists are very good, let's pretend that from the fundamentals of dentistry, both are at the same level, but one is really going beyond with biological dentistry and all these health optimization concepts. If you could summarize, you know, the three major advantages, the added value for your patient.
The added value is, of course, that we are focusing on your overall health. That means we, of course, look, is there any, from the start, is there any material in your mouth that might disrupt your immune system already or your autonomic nervous system? Of course, we will only place stuff that is, let's say, at least neutral. So we are in the business of reparation. So if there's something broken already, we need to fix it with a better solution at this point of time. Yeah, if you're a healthy body and you have perfect teeth, you don't have to do this. So of course, we will take care of not doing any harm. So if there's already stuff installed, we will take care of immunology. So if you're allergic to something, we will take it out. We will have proper solutions for interferences like neuromodulative triggers that can stress your overall system. So we will reduce stressors from your body and also take care about your nutrition and your lifestyle and coach you basically through the next level. And I think this is a lot to get from like any doctor anyways, if you can learn so many things in one session. And of course, the whole clinic structure is to improve. It's more like a spa treatment. You get there, there is no stress. We don't have 50 patients a day. I only do 1, maximum 2 surgeries. We do IVs. We do everything to accommodate it. It's more like, imagine you go to a 5-star hotel. And there's no stress at all. You come in a safe environment, and you really, like you said, we're really trying to exceed everything that you experience. There's no fear. Even if you're on the chair of a dentist, it doesn't feel like it. It's more like a coffee break, like you would say here. that actually want to learn something from you, and they expect. Also, of course, they're very demanding and expect more knowledge. That's for sure. And also, I have to add one point. I don't convince any patient to do this. It's more like the opposite. You have to basically apply to get an appointment in the clinic, because I have to have this mindset first.
Yeah.
Because if this is a patient, yeah, you know what I mean. If it's a patient that doesn't want to take responsibility and doesn't want to change, you will have no results. It's for both sides, it's bad. So it has to be the same level of energy, and then it will be maximized.
No, I like that. You know, the patient needs to be on the same vibe. Of course, the patient needs to really believe that they can do better, right? That they can go beyond. If you want 10 veneers because you want to look better, and then your biological dentist says, no, but you know, you are allergic to this, and you have a lot of that stuff in your mouth, and you have this problem, you know, that is showing up on your blood test that is not allowing you to sleep better, and you have this problem with your nutrition that is not allowing you to perform better. Yes, I can do the 10 veneers and you're going to look a little bit better. But if we take care of all the other stuff, you're going to look much better. And it's looking better from inside out. You know, you're going to smile with much more power, and you're going to use these veneers in a much better way. You know, you're going to impress people in a much deeper way when you're happy from inside, when you feel better from inside, and when you're really on a different level in terms of performance. So what do you think? What do you think are the main, if you can give 1 or 2 or 3 examples of things that dentists are missing the opportunity, you know, by not looking into this, you know, common things that we are doing in dentistry that may cause harm or that are overlooked, that we should pay attention? If you give just a few examples for people to understand, you know, how much deeper dentistry can be.
Yes. So as I said, the mouth is the entrance to your overall body. It's kind of like the entrance to your gut system. Everybody's talking about gut health. Yeah, have you heard about leaky gut and chronic inflammation there? And for everybody, gut starts here. But actually, your digestion and your gut starts in your mouth, and you cannot imagine how diversified your microbiome is there and how much changes will be there due to nutrition, but also, very important, due to things that have been installed by conventional dentistry with one purpose: fixing bites and smiles. Yeah. And this, the common triggers that stress people nowadays epigenetically, you have to know how stress works, but I can go down deeper later, is any metal nowadays. Metals have 3 inherent challenges. They can become an immunological problem, yeah, because your body just reacts to it. It's nothing that should be in your body. It can be toxicological problem, so just toxic. For example, mercury from amalgam fillings. Everybody knows already that this is the most toxic non-radioactive element known to man. Shouldn't be in your body. And the third component is the electric component. You know about oral galvanism, batteries, you know about corrosion. But what you maybe not know is that if you live in an environment that is loaded with EMF, electromagnetic fields, like 3G, 4G, 5G, all these waves here on this one, etc. Any metal overall in your body will amplify these frequencies and change your whole body electric. It's known that EMFs are it's carcinogenic since 2019, and they know exactly how it works. Nobody knows about it. And of course, there are studies showing that, for example, if you do a phone call and having amalgam fillings, you get way more mercury vapor from the call, from the frequencies, like out of the filling, for example. Or if you have just a piercing here, it just gets amplified, and just, let's say, it can disrupt your whole nervous system because your body is electric in itself. So these are metal problems. We all call these root, as though the concept is called oral interference. It's a little bit of a weird name, but in acupuncture and neurotherapy, it's medical. We call it neuromodulative triggers. What triggers your whole nervous system through an inflammation, an ongoing chronic inflammation, through cytokines, through whatever, in your mouth, on your trigeminus, 24/7. And it could be a root canal, it could be a titanium implant, it can be any metal, it could also be a composite or like an adhesive that you may be allergic to. So you really have to understand how everything connects in the overall body. So what does stress even mean? Like, what is a stressor? Do you know about the hypothalamus pituitary axis called the stress axis, and how this connects to your teeth? Do you know about cytokines? You maybe heard of it because of COVID. But what about having a cyst on your tooth? Like, for years it doesn't hurt, but maybe you have cytokines through the roof. Of course, you're way more sick than anybody else, and you might not know because nobody looked into your mouth. Or you have an antenna, and you are feeling weird and have 5 different symptoms, and the doctor tells you, "Nah, you're a psycho." But you know there's something going on and it's wrong, and it's called electrohypersensitivity, but maybe this doctor didn't study this, but it's a real term now. So it's just knowledge updates, and our knowledge actually doubles every 6 months. So you cannot know everything, and you didn't study it. So you really have to sit there and PubMed and do this. I do this for 20 years, and this is why I train dentists and doctors, naturopaths to do so. So I don't have any impact on my own. So we have to all combine our strengths and just learn more. And if you're open-minded and see, oh, wow.
Yeah, that's actually the main challenge. You know, I believe that our society makes us believe, and our educational process makes us believe that we know enough.
Yes.
People, you know, and of course everybody says it's a constant evolution. You're always learning, blah, blah, blah. But at the end of the day, we all get stuck, you know, with the things that we learned, that people are doing for decades, and people don't want to look beyond because it's uncomfortable, you know, to look into areas that you have no clue. As a doctor, you say, I'm already practicing for 20 years, you know, whatever. And now there's something that I have no clue about it, you know. And this is something that I think we should stimulate, that people shouldn't be afraid to open their horizons, to really broaden their vision about health. And for me, there's one very simple thing that is very clear for me: the fact that there's so much we don't know, right? We know so little, and I'm talking about some of the best dentists in the world doing very good dentistry, and we still know so little about the human body and the impact of what we do in people's lives. And we should be very humble, you know, because I see a lot of people very aggressive about this biological dentistry topic. People get very nervous. People tend to attack the topic, you know, minimize the impact of it, ridicularize even the topic. Do you suffer this type of reactions, you know, with this topic?
Yes, you can't imagine. It's getting better and better, but imagine me doing this 10 years ago on a conventional dentistry podium. So I was kind of like ripped off the podium for like 30 minutes, emotionally being attacked afterwards. So ridicule, denial, and anger is normal. It's like all truth passes through 3 stages. Like first, like, you know this Mahatma Gandhi thing. It's going, at first it gets ridiculed, then it gets attacked, and at the end it's self-evident. You never get praise for it. So when I wrote my book, there was, of course, you always get a shitstorm from colleagues, but basically it's their problem. And I know for a fact, all my friends from university, I was already doing this in university. So it's a long time ago. They were always like, you have to believe these things. And some were really aggressive. And one of my best friends is now my biggest fan because he told me it changed his whole life. He's changed his perspective in dentistry, his whole clinic practice every day, also his health, of course. And he is a specialist now. So I examined him and he said, dude, what did I miss in terms of overall health for the last 10 years just by looking in just pure mechanical things? And I can see that there's a change coming. Everybody that gets aggressive, this is always just a mirror from the inside out. This is something, basically it's a fear, like you said, you're afraid of maybe you're missing out. But dudes, why? It's just like you're saying, you should know that you don't know anything. More like a kid, be curious. There's something new. I don't say that what I'm doing is perfect, not at all. I'm only looking for getting better every day and looking for ideas.
That's very important, you know. Somebody bringing something new like you to keep this humble position of saying, I'm not saying I'm right. I'm saying there's more to be learned. You know, we should open our eyes. You know, I'm showing the little part that I already discovered. You know, I already discovered this little part. And I just have a feeling that the more I discover what I didn't know, the more I see there's more to be discovered, you know. And then, of course, you see the results on your patients. And I see, you know, because my father was always like that. He was always very holistic, you know. He was always into comprehensive care way beyond dentistry. You know, he was always into what he calls transdisciplinary dentistry that goes beyond, according to him, beyond the physical benefits of dentistry and involves energy and involves emotions and involves even spirituality, as we all, of course, believe on that so much. And at the end, it's all about energy. When you're talking about your topics, is understanding about energy and how energy is flowing and where energy is stuck and how energy is working against you and how you're having lack of energy or excess of energy. And you know, I know so little about it, but I'm just fascinated by these topics that shows there's much more to be learned, right?
Yeah, 100% agreed. So this is my passion. I like to wake up and learn new things every day. Never changed since I was a little kid. And this is, yeah, like you said, it's like a tiny bit, but I'm so happy that I have found this because every day, through my own experiences and trying things on my body, but also through the patients, I can learn and improve. And whenever anybody comes and shows me something new, I'm always open. I'm never like, oh no, go away, I know everything. Opposite, I'm always listening, taking notes, and then I'm trying it. And if I see it's good, I use it. Or maybe like, it's not good, I just leave it out, try something new. And at the end, when you do this like years and years and years, you add your uniquely own, like Bruce Lee said it, yeah? Use what is useful, reject what is not, and add your uniquely own. And then you come up with concepts. And I'm quite sure, like for example, now we're doing ceramic implants because it's just way more neutral to restore. the mindset that I'm having for future generations is we don't need any implants at all. My kids will know about nutrition. A healthy body is immune against cavity. A healthy body is having wide jaws. There's all wisdom teeth in there. There is no cavitations. And you don't need any reparation later on. Maybe you need a dentist to tell you how to optimize your health. And this is the future mindset. So we start educating the parents and the kids. There's so many studies about cavities related to gluten intolerance, about cavities related to vitamin D3 deficiency. This is where we have to start. Weston Price, one of my idols, he wrote a book, Nutrition and Physical Degeneration, more than 100 years ago. He was the boss of the ADA, as far as I remember, but he was a big explorer, and he looked for tribes in the Aborigines in Africa, Switzerland, and looked how their how their faces were growing, and how the teeth looked like, and if they had any signs of degeneration. And what he found was when these let's say indigenous people ate their ancestral nutrition and diets, they had perfect white jaws, nose breathing, all wisdom teeth in line, no scoliosis. Whereas their kids that might had like contact with sugar and gluten-containing grains and refined oils and conventional dairy, like let's say processed foods, they looked like little monsters. They had like crooked teeth, cavities, lots of tartar, mouse breathing. Basically, they look like our teenagers in the Western world 100 years ago. So why does this knowledge not get applied? I'm very, very lucky and happy that finally through this nutrition stuff, where I give courses, I'm getting now getting to write articles for the conventional dentistry. They are asking me now, hey, I've listened to your topic about optimal osseointegration of ceramic implants and tissue healing through tailored nutrition and micronutrients. Can you write us a topic about this? So finally, conventional dentistry coming through the food and nutrition part, and I'm very lucky. It's already
it's gonna happen. It's all gonna connect.
Yeah.
Hopefully, I have a strong belief that this decade dentistry will evolve a lot into systemic care and holistic strategies like this one. You know, the other topic, you know, airway, and the things that we can do with dentistry to help people sleep better, breathe better. You know, I think this is going to become a huge topic. And combined with this, you know, systemic health optimization, you go to a dentist that understands all these things, and you're very lucky, you know, that somebody can actually help you beyond just biting the teeth together, right? Biting the teeth together. So I want you to finish today our chat. I want you to give us some insights about specific technologies. And by the way, this was actually the initial topic, the reason why we started to chat again, and the reason why I invited you again, because I asked you on the personal chat that we were having, and say, hey, Dom, you know, just tell me, I was actually writing about how technology is helping dentists, and was it basically from the classical perspective, you know, the scanners and 3D CAD/CAM softwares and printers and the restorative implant, digital orthodontics, so the dental stuff. And then I remembered of your topic, and I called you and I say, look, from your perspective, you know, what are the technologies available today? You know, not the conventional dentistry technologies, but technologies that dentists can have to improve the way they gather information, they gather metrics, they track those numbers, and allow them to understand better their patients and provide better healthcare to their patients. What are the main technologies, cool technologies that are available nowadays?
Yeah, for clinic setup, I would say that you could use cutting edge tools that at the moment are most likely more in like a sports performance center, but we're using this for example. Basically, everything is about recovery. How can I help my patient's system or body to heal and recover as fast as possible? So if you can make an implant osseointegrate in better timing or faster without any failure, why not use it? So we use red light therapy. Yeah, this is basically different light frequencies that show tons of research in helping just the mitochondria produce more ATP. They help with wound healing, recovery. You can just basically place them in front of the face or use an overall thing. I don't have one here, but it's in the clinic. And you can, what we do is we stacking these things. We kind of like have a menu, like you would go to a spa. You can say, okay, I want to have this, this, and this in my menu. Of course, we do a lot of intravenous nutrients. In terms of techniques, is not too much, but it's very important to use that. And we use hyperbaric oxygen therapy. This is basically a chamber where you can go in to a, let's say it's just a pressurized chamber. You could go to 1.5 atmosphere, and then instead of like the normal blood oxygenation, you normally have, like, if you do this finger thing, the oximeter, you normally have like 99% like oxygen saturation. But what about your tissues? Sometimes your tissues are starving. And what this machine is doing, because of the pressure and the oxygen that's coming in through some through your nose, you get highly concentrated oxygen in the pressure environment inside your tissues. Your plasma gets oxygenated. So you, again, recover and heal faster. This is stuff like Nadal has in his chamber, like high-class athletes. But it also improves healing. And there's studies showing that it also helps with bone fractures and things. Normally, these chambers are huge and are mostly for like trauma from diving and are in bigger clinics. But nowadays, they are in like tinier versions that you can put for one-piece single unit into your clinic, like your health optimization sphere. And also another thing we do is we combine intravenous nutrients with light. So light is a huge topic. In terms of research, there's everything out there, guys. You just didn't see it yet. But Google or PubMed low-level laser therapy, LLLT. There are tons of research. What we do is we have, let's say, intravenous vitamin B3 or vitamin C or any other substance that is light sensitive. We can have a laser go into your vein and advance, or let's say
amplify
is the word I'm missing, and amplify the use of it, because we know that the same thing happens when you go out in light. This is why we use red light too, just to use the nature, which you normally would do. You go into sunlight, you get all these activations, and we know that the body is actually able to do something like photosynthesis. It's not the same because we're not plants, but we actually can, by the use of molecules that get activated to different light spectrums, can amplify this and produce our own energy through light. It's amazing technology, and it's used in cosmetic care. And I'm quite sure that this will find its place in conventional dentistry or biological dentistry for sure. I'm an early adopter, so I use all these things, but I'm training, so it's coming. This is really cutting edge things that will also help you, of course. Imagine you as a doctor, you have to be, in my opinion, you have to be as healthy as possible, kind of like a performance athlete. You have a really stressful work. You maybe have to concentrate for 5 hours straight surgery. What about you eat crap food? Or what about you have your own lab where you can go once a week and tune yourself, so you can get healthier and more optimized, as well as your patients. So it's a win-win-win-win-win for everybody. So there's lots of tools to use. So I could probably go further on, but of course use lab works, use blood tests, and we have different
allergy tests and blood tests. Yeah,
all that's possible. But then, in my opinion, what you need to know, and this is why knowledge is so important. You as the doctor, you should know why you're doing this, have experienced it, and then time it wisely. When does the patient needs what the most? And this is where experience comes in. So I'm able to prescribe the different treatments, tell you exactly when you should go on a chelation with another doctor, tell you exactly how many sessions you need per this and per this. This is more like knowledge that you can use. Luckily, I do it for a long time, so I can nail it down to like easy applicable things and gets trained there. So this is really, I think it's just next level things that we should use. We also use this one, right? Yeah. So 10 years ago, you couldn't imagine that you can see somebody through a phone, right? But an implant 10 years ago looks the same as an implant nowadays. So why are we not upgrading our knowledge there? We just have to use it. We want to be cyborgs in an unnatural environment. So why not hack yourself to be able to don't get sick, but more healthy?
Yeah, and definitely improve your resistance to things like COVID, right? Everybody is everybody, with this world pandemic, number one protection is your immune system. It's much better than anything else, right? And
100% agreed. And you know what the basis for your immune system is your nutrition. It's protein, it's amino acids. It's more like your life. You have a good immune system if you take care of your body and your overall health. Treat your body like a temple. That's basically it. You live in there. And it's like you say, it's not just a physical level. There's an energy level. That's traditional Chinese medicine, acupuncture, neurotherapy. There's a mental level. There's a spiritual level. And this is all kind of like a pyramid. But the base is what you do on a daily basis, like your lifestyle, your nutrition. So the wider you can get it, the better. And of course, if there are things installed in your mouth or in your patient's mouth that disrupt this or make your internal environment unnatural, of course, this will have consequences over the time. Maybe you can compensate for it, but maybe you got sick already. This is your own genetic. Everybody's different.
Yeah. There's no perfect rule. There's no exact answer. It's all about probabilities, and by applying these things, you're just increasing probabilities of becoming healthier, right? You actually wrote a book. What? Tell us a little bit about your book.
Yeah, the book is written for the layman. It's not a medical textbook. It's of course it's science-based, but it's more about the whole concept. It's called "It's All in Your Mouth" in English. It's translated to almost every country besides actually Spanish-speaking countries yet. I don't know why, but it's probably coming anyways. And yeah, I'm explaining, of course, everything about the things you need to know in terms of techniques. There's a lot about the oral microbiome in it, so that you really get to know the oral cavity and the immune system in there, and how that at the end of the book, about nutrition, about macronutrients, about micronutrients, the critical little things that you need to fine tune, and what can disrupt your whole system. And it's written for the patient, but also, of course, for a newbie dentist, because it's in an easy manner. And you can go deeper.
Fantastic.
Because we need an army of biological dentists. I cannot believe how many patients are looking for you guys. And you have the unique ability to basically see the whole internal environment in one little look into this mouth, when you know all the concepts, what you have to look for besides reparation.
Yeah, I believe dentists have a privileged position in terms of having this relationship with their patients, and seeing the patients once or twice a year. So it's really very powerful if we can use this relationship to go beyond just average clinical treatments, right? Fantastic topic, man. We could stay here talking about this forever. I think it's a super important topic. As you said, we need an army of new young doctors wanting to take this to the next level. Most of the questions are unanswered. Most of the field is unexplored. Patients, I can say patients love this. They really feel like we are taking care of them beyond normal, beyond average. So there's a beautiful side effect of growing your reputation. People like to see doctors that are seeing beyond and trying to give back above their expectations. And this is exactly what people like you are doing. And I think hopefully this topic will grow. My friend, just to end, thank you again for your time, for your know-how, and hopefully we're going to be able very soon to meet in person and chat about this, but live with a good German beer in our hands, celebrating life, celebrating the end of this craziness, and enjoying friendship. And that's the most important. So if you can give your final message and your final goodbye to the DSD community, please.
Yeah, thanks, Chris, for having me. Thanks, guys, for listening to this. And yeah, as I said, be open-minded to new things. This concept really held place in the pandemic because it's slow. It's like biological dentistry. It's like really taking care and focusing. And we were just able to work normally because we're improving health. And like I said, I believe health starts in your mouth. So learn and look further. we are training a lot, so you will find everything probably on my Instagram with the tab bio. And I can't wait to meet you or see you in person, maybe together also with Miguel, and have a good time. Yeah, drinking gin tonic, whatever, eat some good food. Yeah, just that's what you said. I'm totally agreeing. It's all about being a community, and don't be aggressive to anybody. Just be friends and good vibes. That's all that we're here for, right? Improve health and vibing.
That's it. That's it, my friend. Thank you very much, and see you soon.
See you soon. Thanks for having me.
Bye-bye.